Hey, how are y'all doing? This is Candid. I just wanted to have a one-on-one chat with you guys about one of my areas of treatment that I help out with, and that area is TMJ or TMD, as some people call it. I am a massage therapist here in Lafayette, Louisiana, and 4 days out of the week I do work in a dentist's office, Dr. Swallow's office in River Ranch in Lafayette. And pretty much all day long, I see his patients who have TMJ and sleep apnea. So if you have TMJ, you already know what this is. If you don't have it, you may have some of the symptoms of it and don't realize that it is actually what you're suffering with. I can attest to this. When I started experiencing TMJ, I was under a high level of stress. I had a big move in my life. I changed jobs. My kids changed schools. I changed states. A whole lot of things have been occurring. So I was experiencing really bad headaches, mostly in the temporal area. I was having a lot of tooth pain. I thought I had a cavity or I needed a root canal. I didn't really know what was going on. I went as far as having my wisdom teeth removed, thinking that that was causing the pain. I had Dr. Swallow remove my amalgam fillings from my teeth, thinking maybe I had some leakage in my old fillings, and I had him replace them with the new fillings that they use now. I pretty much did it all trying to get rid of this tooth pain and these headaches that I was dealing with, only to find out that my problem really was that I was clenching and grinding my teeth. So whenever I was sleeping at night, I was just really stressed out, and I didn't even realize that I was doing it. And so when I would wake up in the morning, I was really puffy and inflamed, pretty much feeling like I was getting a sinus infection, but I wasn't sick at all. I just had a lot of inflammation from bearing down on my teeth all night. I was getting ear pain. Again, my teeth were hurting severely. Whenever we figured out what it was, Dr. Swallow made me an orthotic. So this is what it looks like. It's just a tooth-colored orthotic that actually sits onto your bottom teeth, and it prevents you from clenching and grinding. Now, there's a lot of different variations of these. Some are big, thick acrylic ones that you put on your upper jaw, some on your lower. This is kind of the newest thing that they've come out with. But it's really effective because the first one that he made me was acrylic, and I was trying to answer the phone all day and I couldn't talk and spit was coming out of my mouth. So I just had to keep taking it in and out. So it was basically only effective for me at night whenever I was sleeping. This one is really cool because I can wear it during the daytime. It's tooth colored. People can't even see it in my mouth. And it's just really helpful in preventing me from biting down on my teeth, my back molars. So it really alleviates a lot of the headaches that I was experiencing. For those of you who don't know what TMD is, it's a disorder of the TMJ joint. So basically it's your temporalis, your mandible, which is your upper jaw, and the joint. So the joint that opens and closes your mouth for you to eat, chew, talk, the one that you use all day long. So overuse of this can cause a flare-up. People who chew gum all day long can cause a flare-up. A lot of different types of trauma. So you could have been in a car accident. You could have been hit in the face. I have a few patients who have been assaulted, and their jaw has been knocked, to the left or to the right, and it's shifted the condyles in their jaw joint. So they're having flare-ups. It can also be caused from dental issues. So perhaps you have like a bridge or a crown on one side of your mouth and you're scared to chew on it, so you chew on the other side of your mouth all the time. You're actually causing an imbalance in your jaw. So if you're always chewing on the right, you're constantly pumping that chewing muscle, so it's almost like flexing your bicep all day long. So what happens? This one's going to be way bigger than this one. So you need to be a little more conscious of your chewing habits. So if you aren't chewing on this side of your mouth because you have a broken tooth or a filling that needs to be done, or a crown or something, you need to get that taken care of, because if you continue chewing on one side of your mouth, you're eventually going to cause you to have jaw pain and headaches, and a couple of other issues that could occur. So a couple of other things could be scoliosis. I have scoliosis in my cervical as well as my lumbar vertebrae. And in my cervical vertebrae, what happens whenever my neck starts to shift, it pushes the base of my skull. It torques it some, so then my jaw ends up torquing as well. And whenever that happens, it puts a lot of pressure, and it causes pressure on this trigeminal nerve, which is the nerve that basically goes like this. So if you're one of those people who get the headaches that crawl on your face, over your eye, under your eye, and into your jaw, you're probably having a trigeminal flare-up. So having your scoliosis taken care of is very important. I was diagnosed back when I was around 10 years old, and it went untreated until I was in my 30s. So all the headaches that I had in my 20s and early 30s probably could have been alleviated had I went to a chiropractor and had them adjust my cervical vertebrae. I have a really great chiropractor, Dr. Brad, and he actually will adjust my whole face as well as my neck whenever mine's flared up, because I can't work on myself. So he does an amazing job, and I actually refer a lot of my patients to him who do have structural issues with their body, their spine. Some signs and symptoms of scoliosis are pressure on the face. So you may, like I said, feel like you're having a lot of sinus pressure when you're not really sick. The reason this happens is because whenever you're clenching down, you're putting so much pressure on your masseter, which is your chewing muscle, that your sinus fluid can't drain. So if you ever see a map of the lymphatic system, you'll see a map of the face. All of your lymph goes out a certain way and then down behind your ears into your clavicle. So if you're clenching your teeth and you're pumping this masseter, which is your chewing muscle, your sinus fluid is trying to drain, and it gets trapped. So a lot of my patients will come in and they have ear pain or even dizziness, and they really don't actually have inner or middle ear issues. They actually just have a little bit of fluid that's getting trapped because this muscle is so tight. So I do have ENTs who refer their patients to me. You know, they go in and thinking they might need an ear surgery or crystals balanced in their ears or different things like that. But actually all they really need is the muscles inside of the mouth to be massaged out, and that creates an opening for that sinus fluid to drain out where it needs to go. So that is headaches, sinus pain. You can have a little bit of vision distortion, and the reason for that is because whenever you're clenching and grinding your teeth, you're putting pressure on all these little bones in your face and the sutures of the skull. So that can actually cause pressure to be put on your retina. So anytime you have a shift, if you think about it, maybe your jaw is shifting a little bit, it's putting pressure right around your eyes and on your orbital bone. So that can create pressure on the retina of the eye, and so you may be having some blurry vision or some vision distortion. So you would never think that, but it's all connected. Other things, like I said, tinnitus is ringing of the ears. Vertigo is dizziness, and all of that has to do with that fluid getting trapped back there and not being able to make its way out because of the pressure on the chewing muscle and on the jaw joint. You may also have trouble eating or trouble opening your mouth to full range. So I do have people who come in and they're basically on smoothies because it's just too painful for them to chew. They can't open their mouth any wider than like a popsicle. So we work inside of the mouth to loosen up all of these muscles, relieve the knots inside of the mouth. The protocol that I've created is very relaxing up until the end. So if you come in to see me, I will put you in a dental chair, lay you back, and I actually massage all of the scalp, the face. I massage the neck, the shoulders, and the reason I do all of that is because a lot of times TMJ flare-ups are from stress or from really tight muscles. So sometimes it has nothing to do with the functioning of the jaw joint. It has to do with all of these muscles right here being extremely tight. So muscles that attach to the jaw joint, like I said, are your temporalis. You have your masseter, which is your chewing muscle. You have some really minute muscles up here called pterygoids. And then right here along your neck from the back of your ear where your jaw joint connects down into your clavicle, this is the SCM. And if you push on it yourself, you'll probably feel it's usually pretty tight, especially if you are in a forward head position a lot, you work on a computer all day, or you strain a lot. So pretty much any of us, we all have a lot of tension in our neck and shoulders. So that's why I work all of these areas. I try to loosen up the shoulders, I loosen up the chest muscles, so that way we can loosen up everything that goes up to the jaw joint. And after we loosen up all of that, then I go into the mouth and very quickly I release your jaw joint. It hurts for about a second, but I can promise you, if you've been in jaw pain for days or weeks, this second of pain is glorious. It is just like a breath of fresh air. You feel the release. You feel like a completely different person whenever you sit up in that chair. The blood starts flowing, the pain is gone, and you may need more than one session because muscle memory happens. So if your jaw is getting used to being torqued to the left or to the right, it's going to try to pull itself back into that position. It's just like going to the chiropractor. You know, you get adjusted and then your body is so used to being out of whack that you have to go a few times or multiple times before, you know, your spine will actually fully release. So it's the same thing with the jaw joint. Some people who are extremely severe, I'll have them come in once a week for 3 or 4 weeks, and then they'll just go on maintenance after that. So once we fully release their jaw, we get them into a place of comfort. I'll just tell them, go ahead and call me if you start getting the headaches again, or you realize that you're clenching and grinding your teeth again, because you don't want to get so far gone that we have to start all over again. So again, some of the things that help to treat TMD or the intraoral massage, working the acupressure and trigger points in the entire skull, face, and upper body, and also maybe wearing an orthotic or a night guard. And like I said, this one's really great because you can wear it in the daytime or the nighttime, and it's really thin. So I could actually talk with this one on and answer the phone and everything. So that's just some options of things that can help you. I just want to also point out that sometimes TMJ flare-ups come from emotional situations. So a lot of times people will come in and they'll get in my chair and we'll just kind of start conversating. And we usually get down to a root cause of things. And a lot of times it's a situation where they're holding on to a lot of anger, or there's some really big changes in their life going on. So I had a patient who was moving out of state. She had been here for many, many, many years, made a lot of friends, but her husband's job was changing and she was having to leave her children, who were grown, but still, you know, she enjoyed being able to see them all the time. You know, once we pinpointed the emotional aspect of it, I was able to kind of help talk her through it. I could barely even work on her the first session. It was so traumatic and painful for her. Her whole body was in an inflammatory response. Like, she was so flared up. But then she came back the next week and it was 100 times better because she had recognized what was causing her to clench and grind her teeth. She had a really good cry session, which you cannot put money on that. Money cannot buy, you know, stress alleviation. It's priceless. And I think that's a huge aspect of TMJ. So just uncertain things going on with your life, changes happening in your life, bouts of anger, just a lot of stress. So just think about those things, kind of recognize what's going on in your life if you start to get this jaw pain or these headaches that happen. I have a lot of college students who come to me So yes, this even happens to young people. They are usually in times of midterms or finals, whenever they pop up on my appointment book, like clockwork pretty much. So just a lot of things like that, you know, type A personalities, people who are driven to perfection. They want everything to be right all the time. They are usually clenching their teeth a lot because they stay in a stressful state. There's just so many different things I can pinpoint, but I think those are the main ones. The flare-ups usually happen in times of stress or, like I said, from traumatic situations like an accident. If you are having this kind of pain, I would suggest that you definitely see a TMJ therapist or a chiropractor before you consider having any kind of jaw surgery or Botox injections into your jaw or anything like that. A lot of times this really is just a muscular issue. Unless you've had an x-ray done and they tell you that, you know, the cartilage in your jaw is completely gone and it needs to be replaced, which is not something that I've seen very often, that someone was that severe. So it can be stopped before it gets to that point. So if you are having any of these symptoms, you guys can message me or give me a call. You can reach me on Facebook at Candid Renee or Candid Mouton LMT, or you can call Dr. Swallow's office at 234-3551 if you're interested in getting a night guard or an orthotic. Again, I'm just here to help. So I hope this helped anybody. If you have any more questions, you can put them down in the video chat below, and I'll be happy to answer any questions that you may have. And if you know anybody that this video may help, please like and share the video. And I hope you all have a wonderful day. Thank you.